We are back with board-certified neurosurgeon Dr. Jagannathan today, talking about something that people are very concerned about if they get a spinal fusion. So tell us what people need to keep in mind.
So a spinal fusion is a surgery where, for whatever reason, the motion of the spine is thought to be abnormal. So you treat that by removing the motion segment of the spine that's not functioning normally. And one of the side effects that people oftentimes fear is the risk of arthritis developing above the spinal fusion. And that's known as adjacent level disease, which is a relatively common finding that you can see after spinal fusion.
Okay, but you say it's relatively common, but maybe not as common as people might worry, and the need of the treatment isn't always there.
That's right. So it's a question that patients oftentimes have before they have surgery, and I think the important part to recognize is that arthritis is a normal condition that happens with aging, and in this case, it's a case of arthritis that happens above the level of surgery. Radiographically, most studies have found that it happens in about 1 in 5 to 1 in 4 patients over the course of about 5 years, so it's not an immediate change. And the other part of it is that when it does happen, not all patients who develop it develop symptoms from it. So when you look at the patients that actually may need treatment for it, it's probably much less than that 1 in 4 or 1 in 5 that I mentioned earlier.
Okay, and you can kind of show us what it looks like here on this, right?
Yeah, so this is a patient who had a spinal fusion done earlier. This patient who had some discs that were degenerated at L4-5 and L5-S1, and you can see after the surgery he developed a disc that bulged out. There's a little one here at L2-3, but larger one at L3-4, and you see how it's kind of pinching the nerves over there. And in this case, this is a patient who developed symptoms from it and tried some treatments such as steroid shots and didn't have a lot of relief and ultimately required surgery. But you know, it's something which is easily treated if it does develop as well.
Okay, because the fusion is a kind of a necessary thing for these patients who are getting them.
In some cases, yeah. I mean, I think the fusion it is usually indicated for cases where there's a slippage of vertebrae or where there's instability or abnormal movement. And the problem is that in those cases, if you don't fuse it, you run the risk just by shaving the bone off and not fusing it of making those symptoms worse. So in those cases, that's why a fusion is required. Again, it's a side effect that oftentimes patients worry about, but in terms of incidence, it may not be as problematic as for everybody as some people may hear.
Yeah, and for those the small few that are, it can be cured with a little bit of surgery.
It can be cured. Usually we start with physical therapy, with injections, and if it doesn't work in any of those, then surgery is last resort.
All right, perfect.
Okay.
Thank you so much,
All right.
Dr. J. I appreciate it. If you want any more information about this condition, about Jagannathan neurosurgery, you can always head to our website, 9and10news.com.